In the late 1970s, a group of tenacious community residents met the challenge of building a not-for-profit hospital focused on providing new services in Ward 7 and 8 in Washington, D.C., and in the suburbs of Prince George's County.
I'm Barry Passett, the president of the Greater Southeast Community Hospital Foundation and Greater Southeast Healthcare System in the 1980s. It was the parent company of the Fort Washington Medical Center before and during and after construction. Fort Washington initially began as an ambulatory care center because we couldn't get state approval for the beds that we had acquired at the old Parkwood Hospital in Clinton.
Many nurses, led by Chief Nurse Judy Burke, rallied to welcome incoming patients and remained faithful to the facility.
I enjoyed more than 21 years of working at Fort Washington Medical Center. First in coordinating the opening of the hospital, and then in seeing enhanced services. It took a determined group of employees and physicians to make sure everything was in place.
My name is Dorothy Maneri, and I am one of the original board members of Fort Washington Hospital, where I served as chair of the board for several terms. I also served as a member of the Greater Southeast Community Hospital Foundation Board of Trustees, the former parent company of Fort Washington.
Even though pediatrics is not our focus, there's one community resident who got her start here.
And I was the first baby born here. My family lives right around the corner, and we still use this hospital to this day.
Many residents see Fort Washington Medical Center as their community hospital, governed by a board that has their best interest at heart.
The hospital staff has been very impressive to me, as they are committed to excellence. That has made it very easy for me to stay on the board these many years because I've seen their efforts in wanting their hospital to be the best that it could be for the community that it serves.
Our employees' commitment to Fort Washington spans decades.
My name is Gabrielle Scott, and I've been at Fort Washington since it originally opened. I was an employee of the Greater Southeast Community Hospital for 20 years working nights. When an opportunity to come here opened up, I came because I wanted to find out what it was like to work in the daytime. I've always been very happy here. When I came here, it was like I was home because so many of the staff from Greater Southeast were already here.
My name is Yene Garanse. I'm a surgical assistant, and I have been with the system for the last 31 years. I enjoy working for Washington because the atmosphere is in such a way, is a very family-oriented type of job and teamwork, which really appreciate. And you are really recognized by your co-workers and the surgeons and the management, your contribution towards the well-being of the patient, which was the motto is patient come first.
On May 1st, 2008, my wife we were at home sitting at the dinner table, and she was making a telephone call. And after about 2 or 3 minutes, the person that she'd called, the answer machine, was still asking for a message, and she did not respond. So I said to her, I said, Ruby, whoever's answering service it is, their tape is full because you're not saying anything. And she did not respond. So I went over and touched her, and she still did not respond. And at that point, I called 911, and the emergency unit came and brought her here to Fort Washington Hospital. And when we came in, there was a doctor who was coming on duty, and she dropped her backpack and immediately started working on her, and she stayed with her until she got into her room, and we will be forever grateful.
We love this hospital. It's a community hospital for us. We've lived in the Fort Washington area all our lives. And when I'm sick, or when I just need a good doctor, or even if it's just a cold, I come here. I even come here just to have an x-ray done, or something like that. It's wonderful service. The staff is polite and professional. We love this hospital, and we support it 100%. We thank the doctors and the nurses for taking such wonderful care of the patients here. Again, this hospital saved my life.
On behalf of the medical staff, we are pleased to be gathered here to celebrate the 30th anniversary of our institution. Only a few of the original staff remain who have witnessed the growth of an ambulatory care center to a full-fledged Fort Washington Medical Center.
When the facility opened as an ambulatory surgery center back I think in '82 or so, and we all moved here and moved our offices here, and we started working here, and it became very obvious very quickly that it was a family environment where it was nice to work, people knew each other, it worked very efficiently, and the patients liked it very much. Patients wanted to come back because it offered something very unique. It offered, again, a family environment, a family atmosphere, and patients liked that. And even as we grew, that sense never changed. So even when it became a hospital, that never changed. And that kept everybody coming back. And that's why, if you notice, the medical staff here has been pretty much the same from inception. We've added some, but the original ones are still here. Orthopedics is my passion. Orthopedics has always been my passion. Oh, I'll tell you a funny story. When I finished medical school, I wanted to be a psychiatrist. Just imagine me being a psychiatrist. Nobody would ever get a word edge in. I'd keep talking indefinitely. Anyway, I got a job in England in orthopedics, and I realized how much I love this specialty. Because unlike other specialties, it's reconstructive. It puts people together. It restores people's movement. It allows people to ambulate, allows people to restore their lifestyle.
Hi, I'm Debbie Galloway, one of Dr. Azer's patients. Dr. Azer has replaced both of my hips over the course of 7 years. I'm back to my normal activities and everything's going extremely well.
I'm Dr. Victor Harry, a member of the medical staff of Fort Washington Medical Center. I've been on the staff for over 25 years. I was drawn to the hospital because of its smallness, if you will, and the family environment that it brings. Very importantly is the fact that many of my patients prefer this hospital because they talk about the good nursing care that they have received. In my practice of allergy, immunology, and internal medicine, I have had the opportunity of admitting many patients to this hospital.
My name is Frank Ryan, MD. I'm an internist and a geriatrician here at Fort Washington Medical Center. I've been a member of the medical staff since 1979. It's been a pleasure to see the institution continue to grow and thrive. I live in the community, so this is my hospital as well. I've been proud to be a member of the medical staff here.
I'm Marjorie Quint-Bouzid. It is my privilege to serve as the site administrator for Fort Washington Medical Center. 30 years ago, this hospital opened its doors to the community, and since then has been the primary source of meeting the community's healthcare needs. As our community continues to grow and change, the acute care services we provide will continue to evolve to meet you at your point of need.
Over the years, we have expanded our services, increased our specialties, and continue to grow, serving more than 45,000 patients through our emergency room annually.
Healthcare is in the throes of major change, and so are we. Hospitals like Fort Washington are expected to broaden their responsibility beyond traditional illness care to serving the healthcare needs of the community. The future brings much promise and opportunity. At Fort Washington Medical Center, We are pursuing the expansion of our facility, patient services, and programs, and investing in our systems to serve you better. Tonight is the continuation of years of dedication and commitment of our staff, physicians, Board of Trustees, and community partners.
Congratulations, Fort Washington Medical Center. We couldn't have done it without you.
I am proud of what you have achieved and that after 30 years, you are still serving the community. Congratulations and best wishes.
This is a great American story. Only in America could this enterprise become a reality.
Congratulations.
We are excited about our next journey and hope that we can count on you for the next 30 years.